Dr. Dex Alvarez here with Palmacia Chiropractic and Wellness Center. And today I wanted to take a couple quick minutes to explain what necessarily a whiplash is. Because I get the question all the time, and unfortunately I had a patient earlier this week who came in who was telling me that she had a minor fender bender. Someone had tapped her from behind about 2-3 months ago, and over those 2-3 months, she slowly started to develop headaches, neck pain, and now, unfortunately, pain down her arm into her hand. She wasn't sure if it was from this accident. It was only about 10 miles an hour of an impact, but she wanted to have it looked at, which was a great idea. And this is a great idea for anybody who is in something like this, any type of an accident like this, because it really doesn't take much impact to create a lasting damage. And your body's natural protective mechanism when you're in something like this is to release adrenaline. Adrenaline is your body's natural painkiller, and that can stay in your system for up to 2 to 3 weeks. So as that adrenaline starts to leave your system, that's when patients will start to typically feel a little bit more discomfort, whether it's neck pain, back pain, pain down the arms or legs. It starts to develop a little bit later because that adrenaline is numbing that pain for up to 2 to 3 weeks. So I wanted to kind of show a couple of examples of what a whiplash really looks like so that you're able to kind of know how it's giving you issues and why it's giving problems. So first, I wanted to show a picture here of a normal neck, of what this should look like when we're taking a look at an x-ray. When you look here, you can see that this head positions back. There's a nice C-shaped curve in the neck, and each one of these vertebrae is lining up perfectly along that back side. Now, in a neck that was in a car accident and creating a whiplash. First thing is you can see how dramatic of a change in the overall curvature from a positive curve, like you see here, to a negative curve, like you see in this patient who was in the car accident 2 months ago. The next big thing is that these vertebrae are no longer lining up with each other. You can see how they're starting to shift forward in relation to the vertebrae underneath it. That's a lot of instability. That means that the ligament on the posterior part of the spine and on the anterior part of the spine is no longer doing its job in maintaining those vertebrae in line with each other. The concern here is when the patient's looking up and down, those ligaments again aren't doing their job, and these vertebrae are moving entirely too much and can A, stress the disc, and B, create a lot of tension not only on the spinal cord, but also on the nerves that are exiting that feed the feeling down the arms into the hands. So that's the big idea of why these whiplash-style injuries, while at first might not feel like a big deal, but can inevitably start to create these issues that down the line can create not only a lot of pain, but also a lot of arthritis and degeneration. So it's important to get in after these small, or large car accidents or a slip and fall or funky tackling or wrestling or something like that. When you start to notice this discomfort, to get in right away, get checked, make sure it's something that can be taken care of and we can maintain it so that it doesn't develop into something a little crazier further on in life. So completely fixable, completely correctable. But if you have any questions, please reach out. We'll be able to answer those questions for you, even get you in, get the proper exam done, get the proper x-rays done, and make sure that it's something we can take care of for you. So I hope you guys have a great rest of the day. I hope it's answered some questions. Take care, and we'll talk to you soon.